Hi everyone, you're probably wondering why is Mark wearing a bowling shirt instead of his typical scrub top. It's because today I am not speaking or lecturing to the medical professional. Today I'm talking to everybody else, the lay person, and I'm here to ask for your help. Before we were getting our butts kicked with COVID, the medical community was aggressively losing the battle on the opioid crisis. So much so that the AHA put out an opioid algorithm for the lay rescuer, for the average guy on the street, and we're going to talk about and review that today. But before that, a quick word from our good friends at Narcan.
Narcan, naloxone hydrochloride nasal spray, is FDA approved for the treatment of an opioid emergency, such as a known or possible overdose.
Okay, so it's pretty clear that if you have opioids or narcotics in your home, you should have Narcan. Narcan is the antagonist, basically the antidote for these narcotics. It's in a nasal spray, you stick it up their nose, you depress the plunger, and that will administer 4 milligrams of Narcan. Now, looking down the algorithm, step 1, if you suspect they're an opioid overdose, get on the horn, call 911 first. And you're going to do this by using your cell phone. Pull out your cell phone, call 911, put it on speaker so you can talk to the dispatcher and they can ask questions while you're helping this victim. Next thing, are they breathing? If they're breathing, you want to administer the Narcan and stay with them. If they have snoring kind of respirations, which goes a little beyond the algorithm, but if they're snoring, typically the tongue is blocking the airway. One way you can help the opioid overdose to maintain their airway, to keep it open, take your thumb, put it under the bony part of the jaw and lift straight up. That'll help pull the tongue off the back of the airway and maintain their airway until help gets there. Now, the second part of the algorithm, if they're not breathing, for the lay rescuer, they want you to begin CPR, which means you have to take a CPR class. In addition to performing CPR, you're also going to administer the naloxone or the Narcan. Now, Narcan comes in all kinds of preparations in a vial. They got the nose thing. Here's an auto ejector that I carry with me every day. I just have it in my bag when I'm going to work. Works kind of like the same, like an EpiPen, almost the same thing. So it can go up the nose, it can go IV. This drug can be administered IM, multiple routes for administration. More importantly, have one. I'm Mark. Thanks for watching. We'll see you in the next video.